So Dr. Santini, what are the most important questions I should ask my doctor about mutation-driven treatments?
I think that it should be really an issue addressed immediately when one person is diagnosed with MDS, because the genetic testing and the test of gene mutation are extremely important for determining the prognosis of the single patient. The first question I should ask to the doctor, the physician that is who's treating me, would be, as a patient, would be whether it's possible to be tested for genetic mutations, and whether the type and number of mutations that are accessible in that specific center are a number that is good enough to have a wide overview on possible mutation. This is because sometimes you have a more limited number of genes that are evaluated for mutation, and in other center you may have a huge number. This makes a difference if you are affected by, let's say, less frequent mutation that can still be important for your prognosis. Having said so, one test that is really incredibly important and should be always be performed is the karyotype, that is the study of the chromosomes. This is really something you should really pretend and ask, but because it's giving us, even if it's abnormal only in 50% of the cases, the first evaluation of the prognosis of MDS. Mutations are becoming more and more important. They will be implemented more and more in the prognostic evaluation and also in diagnosis of all MDS cases. And what you should ask to your doctor is also whether the plan is to repeat such a test over the disease follow-up, because this could also be critical to choose new therapies and to choose possibly targeted agents to treat your MDS.